It's really important to say what an honor and a privilege it's been to work with Steve over the years through C5, and we're really excited for him with the Crayon study. Okay, well, it's hard to believe, it's impossible to believe, but our last talk is about to take place. Thanks to Dr. Kimmie Eng, who's going to come back and just give us a little bit more information about the Dana-Farber program, and then it'll be reception time.
So it's very hard to be the last talk of a long day, so I will try to go quickly. It is my pleasure to introduce our brand new prospective cohort study, which we have named the Beyond CRC Project, Better Understanding of Young Onset Colorectal Cancer. We all know the study rationale has been reviewed many times today, but this is to address the rising incidence for which we don't really understand what the etiologic risk factors are. We also are still not completely sure whether these cancers are biologically distinct from later onset colorectal cancer, and so having a big cohort that is comprehensively annotated would hopefully help us to address this question. Also, although it's hard to get colorectal cancer at any age, young patients do face unique challenges, and we heard about many of them from the patients and survivors who spoke up today. And so, therefore, there's an urgent need for a novel means of prevention, early detection, and treatment. Now, what are the problems now and knowledge gaps? There are limitations to the existing cohorts that are here today. One, the contemporary cohorts that have people of the relevant birth cohorts have a limited number of cases to this date, which doesn't give us adequate sample size or power to answer a lot of the questions that we want to answer. There's minimal racial and ethnic diversity in a lot of the established databases and cohort studies. Many do not have stool specimens for microbiome analyses. There has been non-uniform collection of dietary and lifestyle data with perhaps unvalidated instruments, and many of them only have a single time point of collection of biospecimens and data. So to try and address all of these knowledge gaps, we have started the Beyond CRC project. So Beyond CRC doesn't just stand for better understanding of young onset colorectal cancer, but the word itself, beyond, has deeper meaning, because there are many ways to live beyond a diagnosis of colorectal cancer. One is certainly completing treatment and entry into survivorship. Another is living with cancer and treatment and learning how to cope with the diagnosis. As we heard today, it's not just about the medical treatment, but treatment of the entire patient, as well as their family members and support systems. And then another way to live beyond a diagnosis of colorectal cancer is to help future patients through research. So our study objectives are to improve our understanding of the risk factors and biology of young onset colorectal cancer, which will then lead us to hopefully discover novel means of prevention, early detection, and treatment. We plan to accomplish this by assembling a large cohort of men and women diagnosed with colorectal cancer at an age less than 50. And we want to collect all the data and biospecimens needed to address every potential aspect and hypothesis about why this problem is happening. This includes tumor samples, both archival specimens and fresh tumor research biopsies and resections, DNA, genomic tumor profiles, blood samples that can be collected at baseline as well as serially throughout a patient's treatment course and natural history, medical record data abstraction, which will include information about body weight, medications, treatment, progression-free survival, and other outcome data. Stool samples, again, baseline as well as serially throughout treatment and natural history. And finally, a very comprehensive diet and lifestyle questionnaire. So again, this is a prospective longitudinal cohort study, but we actually are incorporating a simultaneous recruitment of healthy controls to allow for some nested case control analyses. And these controls will be people going in for colonoscopies, as well as family members and friends of patients who come into our clinic. The eligibility is any patient diagnosed with colorectal cancer at an age younger than 50 years, and patients will be enrolled at the time of their initial consult visit or the time of recurrence or metastasis. They will be followed until discharge from surveillance, lost to follow-up, or death. And this is our schedule of data and biospecimen collection. So throughout the entire course of a patient's journey, we will be collecting and abstracting data from their medical record. At enrollment, we will collect fresh tumor samples, archival tumor samples, blood, do genomic profiling, collect a baseline stool sample, and have them take a self-administered, very comprehensive diet and lifestyle questionnaire. And then as patients start treatment, we'll plan to get blood samples and stool samples at baseline, early in their treatment, 2 to 4 weeks in, and then again at treatment discontinuation. And this will continue for all the treatments that they receive. In selective cases where we have an interesting research question to address, we have the ability to incorporate fresh tumor biopsies at baseline, on treatment, as well as post-treatment. And the dietary and lifestyle questionnaires will be administered once a year. The questionnaires are modeled after validated questionnaires that have been used for decades in the Nurses' Health Study and Health Professionals Follow-Up Study. We've also successfully incorporated these questionnaires into CALGB and Alliance Cooperative Group clinical trial protocols for survivor studies. It will be administered via REDCap at home or during their infusion visit. And the questionnaire items address topics such as early life exposures, intake of diet, supplements, and medications, physical activity and sleep, as well as medical history and family history. Our stool collection kits will be sourced through Biomass, which is the biobank for microbiome research in Massachusetts that's housed at the Harvard Chan Center for Microbiome in Public Health. It has taken years to settle on the perfect kit, but this really was designed with patient convenience in mind, and we've held focus groups with patients to try to come up with the ideal kit. They're small in size. They can be shipped at room temperature through regular postal mail. All of the tubes are barcoded, processed, and stored by a robotic handler, so it's very easy to inventory them as well as pull samples for analyses at any time. And the collection methods were carefully chosen to allow for maximum flexibility with downstream analyses. The analyses will be performed in conjunction with our colleagues at Harvard Chan School's Microbiome Core, with Curtis Huttenhauer, and the Notobiotic Facility with Wendy Garrett, who are really two leading researchers in microbiome science. So where are we now and what is in store for the year ahead? We will be fully launching the full data and biospecimen collection later this month. We've already been collecting tumor samples, blood, and DNA, but we're now adding in the stool and the dietary and lifestyle questionnaires. We will be launching the data collection and biospecimen collection and healthy controls in the near future, and are looking now to expand to our satellite sites internally in the New England area, but also looking for external participating sites, and are in conversations with several already. And the reason this is so important is because we need to facilitate patient accrual to these studies if we want to arrive at answers quickly. We also want geographic and racial diversity. That's really important for these dietary and lifestyle questions we have, as well as microbiome analyses. And it's important if we want to pool across studies that we have to align our study methods. So that will take a bit of time as well. We are going to be convening cross-disciplinary experts from basic science, epidemiology, and a variety of disciplines to conduct research projects, some of which are already ongoing, and then hopefully submit for grant applications as well. That's all I had. Thank you.